Monday, December 9, 2013. In April, the Boston Marathon made international headlines when it was rocked by two explosions that killed 3 people, injured an estimated 264, terrorized the city, and emotionally scarred those directly affected by the tragedy. A new study, published online today in the journal Proceedings of the National Academy of Sciences, found that the psychological toll was higher among those who actively and repeatedly sought out media coverage of the Boston Marathon bombing than in those who were present at the marathon. Contrary to popular belief, the researchers said, indirect exposure to a traumatic event through social media and online news may pose a greater risk for emotional harm than meters and direct exposure. We are now in the uncharted waters of almost constant exposure to social media, said David M. Rees, MD, a trauma expert and psychiatrist based in San Diego. Via social media, we can now be repetitively, intensely, and even personally engaged in events immediately after they happen or even while they are occurring. Dr. Rees was not involved with the new research. The emotional health impact of widespread media coverage. Scientists like Roxanne Cohen-Silver, Ph.D., who has studied the emotional effects of news coverage of disasters and other traumas, agrees that the new ingredients in the mix are social media and online news. In research that we conducted after the September 11 terrorist attacks, we saw that the psychological impact of the terrorist attacks extended beyond the directly affected communities of New York and Washington, D.C., said Cohen-Silver, co-author of the new study and professor of psychology and social behavior, medicine, and public health at the University of California, Irvine. We believe that media was a conduit through which these effects were dispersed broadly, she added. We found that people who watched more than 4 hours a day of 9/11 and Iraq War-related television coverage, in the weeks after the attacks and at the start of the war, reported both acute and post-traumatic stress symptoms over time, Dr. Cohen-Silver said. Those who watched more than 4 hours a day of 9/11's related coverage in the weeks after the attacks reported physician-diagnosed physical health ailments 2 to 3 years later, she noted. Social media came on the scene after September 11 and has made it easier for people to engage with news coverage and get news as it's breaking. Media exposure now means more than just television, said Cohen-Silver. Today, individuals get their news from a variety of traditional sources, TV, radio, print, and non-traditional ones, Facebook, Twitter, YouTube. How the Boston Marathon bombing study was done. Cohen-Silver and her co-author, E. Allison Hallman, Ph.D., Associate Professor of Nursing Science at the University of California, Irvine, wanted to see if there was a connection between prolonged media exposure to the Boston Marathon bombing and acute stress, which includes feeling anxious, on edge, or hypervigilant, avoiding thoughts about or feeling detached from the event, and having intrusive thoughts. The researchers also looked at how direct versus indirect exposure to the bombings affected stress symptoms. Direct exposure included being at or near the marathon itself, or knowing someone who was present at the event or was injured or killed in the bombings. Indirect exposure was defined as exposure to television, internet, social media, print, or radio coverage of the disaster. The team surveyed 4,675 adults in Boston, New York City, or elsewhere in the United States 2 to 4 weeks after the marathon, gathering information about stress symptoms, hours engaged with media coverage of the event, degree of exposure to the tragedy, and meters and direct or indirect exposure to the September 11 attacks, the Sandy Hook Elementary School shootings, and Superstorm Sandy. They found that people who spent at least 6 hours a day on media coverage during the week after the marathon bombings were 9 times more likely to have high acute stress levels than those who spent less than 1 hour daily on such media coverage. As the hours spent on media increased, the amount of acute stress also increased. The 24/7 effect, social media and online news. Although 6 or more daily hours of news exposure might seem unusually high, the authors emphasized that this is not atypical given the increasing use of social media to get the news. We do not believe that people who engage in such behavior are more likely to have a pre-existing mental health condition or a predisposition for experiencing negative psychological responses, said Cohen-Silver. Study participants' pre-disaster mental health status and typical patterns of media use did not play a role in their relative stress levels. Interestingly, Hallman and her team discovered that past exposure to a traumatic event can affect psychological sensitivity to a subsequent trauma, but it depends on the type of past traumatic event. There is evidence in our data that individuals who had previously been exposed to violent community events, 9/11, the Sandy Hook school shooting, were more vulnerable to the impact of the Boston Marathon bombings, said Cohen-Silver, but that we did not See those effects in individuals who had been previously exposed to Superstorm Sandy, a natural disaster. Setting media limits to protect your emotional health. There's nothing wrong with wanting to know what's going on when something like the Boston Marathon bombing occurs, said Reese. It is perfectly normal to be curious and even attracted to viewing traumatic events in the media. It is also perfectly normal to tend to watch the event somewhat repetitively in a conscious or unconscious attempt to put the event into some type of emotional and cognitive context, he noted, and brief exposure may even help you better cope with the trauma. But, he added, while being attracted to traumatic scenes is not necessarily pathological, it is also not particularly